Good afternoon, everybody. As of this morning, North Carolina has 40 confirmed cases of the new coronavirus COVID-19. We know that there will be many more to come. The good news is that we have no deaths to report and that all of the cases can be traced to travel outside of the state or contact with a known positive person. However, we know that this will change. It is likely we already have community spread, which has yet to show up in the testing. And we know that more people will get sick and that lives are in danger. Therefore, reasonable but strong actions are needed now to help suppress the spread of this virus and to save lives. Today, we take another step. North Carolina bars and restaurants will be closed to sit-down service and limited to only takeout or delivery orders starting at 5 p.m. today. We are in unprecedented times. This will be a hardship, not only for the restaurants and their owners, many of which have voluntarily closed, but also on their customers who find comfort at their chairs and tables. It will also be a hardship for the employees who depend on them for their jobs. We did not come to this decision easily, but North Carolina must keep fighting this pandemic with the right weapons. On Saturday, I ordered restrictions on large gatherings. There was guidance to restaurants and bars to keep more people separated. I commend those who took this guidance seriously. Unfortunately, some have not. So today we're ordering them to close. Takeout and delivery will still be allowed, and please know that grocery stores will remain open. I know there's a natural tendency to stockpile food in emergencies, but I urge people not to go overboard. Leave some for others, especially those who can't afford to buy a lot of food all at once. I recognize that this decision will cost people their jobs. So this order also brings them some relief. Today, I am taking down some of the barriers to unemployment benefits in response to this unprecedented health crisis. My executive order does, among other things, 5 important things. First, it removes the 1-week waiting period to apply for unemployment benefits for those workers who lose their jobs. Second, it removes the requirement that a person must look for another job during this time when so many potential employers are closed and social distancing guidelines are in effect. And I know that many employers will want to hire many of their employees back when this pandemic subsides. Third, it allows employees who lose their jobs or in certain cases have their hours reduced due to COVID-19 issues to apply for unemployment benefits. Fourth, it permits applicants to apply for benefits remotely by phone or online. And finally, it directs that employers will not be held responsible for benefits paid as a direct result of COVID-19 claims. These changes are designed to lessen the hit on our economy and workers' wallets. We know people want to work and that businesses want to stay open. The reality is that many can't. We believe that there will be additional help for both workers and businesses from the federal government, and I urge Congress and the President to act. People are out there helping each other every day, and I want to commend the businesses that have stepped up to aid their employees, their customers, and their communities. But the new reality is that people will be losing jobs, and businesses have lost customers. These are unsettling times. I know some people are afraid. Some are angry. Many are worried. But we will get through this. You have my personal commitment and the commitment of my administration to work tirelessly and make the very best decisions that we can. Some things are just going to have to change for a while. On Sunday, my daughter came home from school. As much as I wanted to give her my usual hug, I didn't. Other people are waving at and talking to loved ones in nursing homes through outside windows. Small businesses are telling their employees they have to let them go for a while. People are waiting for test results. Frontline healthcare workers are bravely carrying on, treating patients and preparing for the surge. As North Carolinians, it's time for us to be at our best, to not lose sight of our shared values, to be kind and to look out for one another, to pray for each other, to be smart and to remind others to do the same through our words and our deeds. This will be a long and difficult road for us to travel. But we are North Carolinians, and we are resilient. And even as some things change, who we are will not. We will learn from this, and we will be better than we were before. I have on stage with me today the Secretary of the Department of Health and Human Services, Dr. Mandy Cohen, our Secretary of the Department of Public Safety, Eric Hooks, our Director of Emergency Management, Mike Sprayberry, and I'm now going to recognize Dr. Cohen for a few remarks, and then Secretary Hooks. Brian Tipton is our sign language interpreter for today. Dr. Cohen.
Thank you, Governor. What we're experiencing is unprecedented, as are the actions we are taking. These are incredibly hard decisions with real consequences. Our goal is to slow the spread of the infection so fewer people get sick at the same time, and we don't overwhelm our medical system resources. I know there's a lot of confusion about the information that's out there, starting with the size of gatherings. The President's guidance asks people to limit gatherings to less than 10 people for the next 15 days. The Centers for Disease Control and Prevention recommends that gatherings not exceed 50 people for the next 8 weeks. And for now, the executive order will stay at 100 people for what will be enforced by local law enforcement. So what does that actually mean for everybody? This means using really good judgment and practicing social distancing. Remember that means staying approximately 6 feet away from other people whenever possible, washing your hands, using hand sanitizer, practicing proper respiratory etiquette, including coughing into your elbow. I particularly urge folks who are higher risk, over the age of 65, or have chronic diseases or a weakened immune system, to be particularly vigilant. And understand these guidelines, these requirements might change. I know people want definitive answers, but we need to be prepared that recommendations will change based on the situation in North Carolina and the latest information. It's a fluid situation, and that requires us to react and change and adapt. I also know that testing is on everyone's mind. As of this morning, we have 40 positive cases in 16 counties. We know that more than 1,100 tests have been completed in the state, and thousands more samples have been collected and are in the pipeline at laboratories across the state. First, it's important to note that the positive test results reflect all the testing being done around the state from many different sites and laboratories. Our North Carolina State Lab is just one piece of the testing picture now, which is great news. Hospitals and commercial labs are testing, and we're working on reporting all the numbers of tests, positive or negative, regardless of where they're being done. But if you do report on the number of total tests done at the state lab, it's important to know about that broader context that more testing is happening across the state. Second, regarding testing, an update on people accessing the COVID-19 test for themselves. We are working with the healthcare community across the state to expand sample collection sites for patients who might have COVID-19. Last night, we sent clear guidance to every doctor in the state through our medical board on how they can collect samples from appropriate patients while also protecting themselves and other patients at their practice. If doctors are unable to collect samples for testing in their office, we are working with our public and private partners to expand sample collection for doctors to refer someone to an alternative, non-hospital-based site. If someone's experiencing symptoms and they think they may be due to COVID-19, meaning fever and cough, they should call their doctor. And if they don't have a doctor, they can call their local health department or their local community health center. If we see a need for more sample collection sites, we'll be working with our community partners to stand them up. Understand this is a major focus for our teams, and we're working around the clock to support our provider partners. Ramping up testing is important for where we are right now. The level of intensity of testing will change as we move through our response. Testing will become less important at later stages of responding to COVID-19. As we weather this pandemic together, remember that the actions we take now are so that fewer people get sick at the same time, so that those who need more serious medical care will have it. And a reminder that most people who get the virus will not need medical care. All of these measures remind us that our lives are connected and interdependent, which is perhaps the hardest part of what we are being asked to do. We need to take a step back, at least physically, from the many things that give us joy and support. All of this can take a toll on our mental health. So I want to remind people that support is available, and look for resources on our website at ncdhhs.gov/coronavirus. We have a responsibility to do all we can to help protect our loved ones and our neighbors who are older, who have underlying health conditions. Just as we act together, we will get through this together. Thank you, Governor Cooper, for your leadership.
Thank you, Dr. Cohen, and now our Secretary of the Department of Public Safety, Eric Hooks.
Thank you, Governor. I would say we're indeed fortunate in the state of North Carolina. We are not taking anything for granted, but under the strong leadership of the governor and our state emergency response team, partnering and taking the sound scientific and medical advice from Dr. Cohen, that our state emergency response preparedness is strong in North Carolina. We have come together to address this unique threat. We're actively engaged with all of our local emergency management partners and law enforcement throughout the state. Here at the EOC, under the strong leadership of Mike Sprayberry, our National Guard, as well as the Highway Patrol, they've been actively engaged in planning operations and future planning operations. And just as we have leaned upon one another, and that's not just here at the Emergency Management Operations Center, but all throughout North Carolina, We have faith in the people of North Carolina to come together as we face this threat as well. And this message is really for all communities. Please follow those public health safety advice that you've been getting from Dr. Cohen. Please only lean on trusted sites for information, such as the Department of Health and Human Services and the CDC. I cannot stress this enough. We'll continue to work together, and we look forward to North Carolina continuing to pull together as we address this threat.
We'll now take questions for the three of us. No questions?
Governor, sorry,
Yes.
we're having come to the
Oh,
microphone.
got it. Okay, sorry.
In regards to relief for businesses, we're hearing from businesses who are concerned and are asking about what about sales and use tax, payroll tax for those restaurants that are having to shut down except for takeout and delivery.
We know that our small businesses are going to need relief. We have expressed this to both our members of Congress and the President, and they are working on a significant relief package right now. We're also going to examine all of the other issues that affect businesses in North Carolina and see what further actions that we need to take to try and soften the blow. We know that this is an unprecedented and abrupt halt of doing business, and businesses both small and large across our state and across the country are facing a new reality here. The first thing we wanted to make sure that we did was to provide for expanded unemployment benefits. To their credit, the thing that I've heard from the most from restaurant and bar owners is what's going to happen to my employees. They have told me that and have asked me to do whatever I could to try to provide relief for them. And what we've done with these unemployment benefits do help to provide that relief, because I know that the idea for most of these small businesses, and particularly the restaurants, is that they want to be able to rehire these employees once this crisis subsides. And the current unemployment benefits law requires someone to be looking for another job in order to receive those benefits. And waiving that requirement and waiving the 1 week requirement and providing for some relief for people who have reduced hours and waiving the mandatory in-person interview that has to happen, and that can now happen over the phone and online, and making sure that those employers aren't charged for the people that they lay off. Under current law, the employer would have to pay in order to put someone on unemployment. For COVID-19 related issues, those employers would not have to pay. So all of those things are a positive immediate step that we're doing today. I believe that there are more actions that we can take at both the state and federal level in order to provide relief for businesses and help for workers, and I think people are working together in an unprecedented way.
I just had a quick testing question. I don't know if Dr. Cohen wants to address it.
Dr. Cohen?
We're hearing from healthcare systems trying to get moving with more testing. They're stepping up as well. They're facing shortages of supplies. Days ago, you were saying we're okay on swabs and samples. Now they're telling us that's in short supply as well. Can you speak to that issue right now?
Sure. Thank you for the question on supplies related to testing. And again, to be clear, there are a few different pieces of the chain as someone would get a test. One are the swab kits that are directly swabbing someone's nose or their throat. Those are the sample collection sites that we are standing up in community-based sites. Then there are the reagents that are needed in the lab. And much of our conversation had focused on the reagents because that was the rate limiting step. But we acknowledged that there were supply chain issues all along the way here. I will say that for North Carolina, I feel like we're in the best position that we can be. Doesn't mean I'm not concerned about supply chain issues, and that if folks are concerned about particularly the swabs, the hospitals and providers, to get in touch through their emergency management chain, through their local health department, and up through the emergency management chain, and we'll make sure that folks can have resources. But what I would also say is we know that testing isn't going to happen everywhere in every medical site across our state. We know that we're going to need to consolidate to those, both to conserve our protective equipment, to make sure that we are using that in the most efficient way possible, and also to make sure that we are preserving our supply chain, which is exactly why our criteria still remains the same for folks to get a test, which is someone with a fever, cough, and is flu negative. We still want to be testing for flu so that we are doing as much as we can to maximize the supplies that we do have. But we are coordinating at the state level to make sure that folks have access to supplies. But supply chain is going to be, I think, a thing we are going to be keeping our eye on constantly, not just for testing, but for the personal protective equipment supplies as well. Thank you.
Governor, this question.
Wait, right over here first. Oh, got it. Sorry, I didn't see that over there.
Okay, Governor, obviously we've talked a lot about restaurants and bars, and for good reason, but what about other businesses, retail stores, barber shops? Are there any limitations being planned for those types of stores right now?
So we try to plan for every eventuality, and we're going to take steps as we see that they are necessary for North Carolina. One thing that we want to continue to emphasize is that grocery stores and pharmacies will remain open. We're going to continue to look at the evidence, the medical evidence, the health care, to see whether businesses are abiding by the guidance that they have been given. We would rather people do this in a voluntary way and try to get us all working together on stopping the spread of this virus. But we will consistently and continually analyze all of the potentials that are out there, and we'll have to wait and see as we move forward.
Just one follow-up question. We're getting calls into our own newsroom from managers of stores who say they're paying out of their own pocket for cleaning supplies at these retail stores and things like that. Any kind of relief possibly on the way for cleaning supplies for those types of businesses?
I think we are looking for all kinds of relief to businesses and workers for this unprecedented economic situation here. And we know that a lot of that has to come from the federal government. As state government, we're going to use everything that we have, but we are bound by our balanced budget that we're required to have in North Carolina. We're going to use everything that we can to make sure we help people, but we also know that a very robust federal package is coming, and we want to make sure that our state response is coordinated with that federal package when it's finalized, so that we can have the necessary match money that we might need in certain situations, and so that we can also complement whatever the federal government does not do. We've done that effectively over the years. Unfortunately, we've experienced several hurricanes and other weather disasters in our state. We have one of the best emergency management teams in the country that knows we've been successful in working with the legislature to try and complement what the federal government is not doing. And we will be ready to do that. Yes.
Governor, can you speak to the essential nature of the DMV? We understand that these offices are still open and operating, conducting driving tests, obviously creating a challenge when we're talking about social distancing.
Right.
And also, we have a question about daycares. You have ordered the closure of our K through 12 schools, but will you order daycares to be closed? And what's your recommendation on that today?
The number one thing is we want all of our state employees to be safe, and all of our essential functions that are going on in state government, there is guidance being given to the employees, and our Human Resources Department is working closely to make sure that the public is still served, but that our employees are being protected. And that analysis is constantly going on with our Department of Motor Vehicles. As for the closure of K-12 schools, of course, it is mandatory for children to go to school. A lot of parents were very concerned about that. So we issued the order for the protection of the public, for the protection of our children and teachers. We know that child care centers have been provided very specific guidance on how to keep children safe, the workers safe, and the parents safe who come there. We also know that child care is essential for our frontline healthcare workers. And I will let Secretary Cohen address that issue. That is not a recommendation from our from state government at this time, but Dr. Cohen.
Thank you, Governor. I think you said it well. I mean, the many child care programs are weighing decisions on staying open or to close programs, and the truth is there's no right or wrong answer, but the reality is that we need them, and we need them to help our frontline healthcare workers or our folks who are going to be working in our grocery stores that we know are going to see a change here, our pharmacies. And we are working hard to give them the best guidance possible that they can take. And so we will continue to support them in every way that we can. And for those who decide that they can remain open to serve our families, to fuel our economy, we're so grateful to them because we do very much value them, but know that on the great news in this, and I'll say this as a mom of a 5 and an 8-year-old, is that while some of us can do this hard work to respond to the virus, to know that if our children got sick, that the severity of illness is so much less for them, is so comforting as a parent. I think we want to make sure that those on the front lines of our in our healthcare workforce have the opportunity to be at work and to focus on those patients that are going to need their care.
Dr. Cohen, while you're at the microphone, one question about the testing process. We're hearing from folks who were tested and they are waiting for their results. In the meantime, only that person is apparently required to quarantine. The rest of their family is not. Can you speak to that and clear that up for us?
Sure. When someone does say, I have a fever and a cough and is found flu negative, and then we run a COVID-19 test on them, yes, we ask them to stay in what's called isolation, meaning that they're having symptoms, and we want them to be isolated until they get that result. Obviously, if that result is positive, they will continue in isolation. Until we know that, obviously, we want to be keeping folks as separated as possible, right? I think folks should assume a positive until they get the result and do as much distancing within the household as possible, good hand washing, and try to isolate themselves. If they are found positive, we will make sure to help give them some additional guidance on how to further keep distances away from other folks. But yes, we want them to isolate while they are waiting for their test results. And as I said, we've tested quite a number of folks in the state of North Carolina. The vast majority of them who are ill do not have COVID-19. They have something else, and we still want them to have distance from their family members so they don't spread those illnesses. So I think good judgment on separation and hand washing within your own house while you're ill still applies. So in terms of time for getting your result back is very variable depending on where that sample collection and which lab it was sent to. So I can't say. We're hearing some can be as quick as 1 to 2 days. Others are 4 to 5 days. And so we know that when someone gets a test, it can be an extensive period of isolation that we are going to be expecting of them until that result comes back.
Yes.
Yes, Governor. Does this order change anything in Executive Orders 116 or 117?
It does not.
Does not. Follow up.
Yes.
So what provisions of 117 extend to private property, including churches?
The provisions of 117 on gatherings, it applies to all public gatherings, but there are exceptions for certain things like airports and other retail establishments.
Okay, and last part, do you believe that the criminal sanctions with the guidance given by the North Carolina Sheriff's Association are enforceable with respect to private property, including churches?
We do believe that they are enforceable. However, we believe that the people of North Carolina are going to pull together and do the right thing. And no one wants to enforce these kinds of orders, but we need to show the seriousness of the situation. And if some entity or somebody continues to flout the law, then local law enforcement, local district attorneys, and others would have to make decisions about whether to move forth. What we want to do is to push people to do this voluntarily, to realize the seriousness of this, that public health is at stake and that lives are at stake, and particularly younger people who can become infected and may see mild to no symptoms, but then they can carry it to a loved one who would be in an at-risk category, and it could be a deadly thing. So we want people to abide by the law. Yes.
First one for you, Governor, and then the second one either for you or Dr. Cohen. The first, we know the federal government has extended the tax filing deadline. Would you consider something similar here in North Carolina?
Our tax filing deadline automatically extends when the federal government changes the law. I'll check on that just to make sure that it's my understanding that we are tied to the federal law and that ours would extend. And I'll challenge some of the lawyers on my staff if I'm wrong about that, to maybe by the end of this press conference be able to tell you otherwise, but I think that's correct.
Okay, thank you. And then the second question is, obviously a lot of restrictions, schools closed, bars and restaurants. Anything in consideration when it comes to nursing homes or senior living facilities in terms of who can visit them?
Yes. We want to protect people in the at-risk populations most of all. These are the people who have a much worse situation, and they get much sicker, and there's more of a chance of this virus being fatal to them. So we have sent strong guidance to nursing homes and rest homes, and I'm going to let Dr. Cohen say a little bit about exactly what we have told them to do.
Yes, we'd be happy to get you the specific guidance, but we've been very clear that we really want to limit visitors at our nursing homes and long-term care facilities. There are exceptions for end of life, so we're trying to make those accommodations. And when folks do need to let in visitors, to do a fair amount of both social distancing, washing hands, but also temperature checks as well. I will say at our own state facilities, where we have nursing homes that are state operated, that we are not only checking our patient population often, but our own employees as they enter the building to make sure that they are not bringing any unnecessary germs into those settings.
You guys have set strong guidelines, but for private facilities, it's up to them, basically, at the end of the day.
So the Centers for Medicare and Medicaid Services are the ones that set the policies related to how survey and certification and sort of the infection control processes that these folks have. So they are bound by those. Those are not recommendations. Those are you musts. But from the federal government, it is our job in the state to enforce those. We will be doing it. We're trying to give guidance so folks understand the step-by-step procedures that we do as well.
Thank you.
Thank you.
Yes, sir.
I had a question for Director Hooks. What guidance is he giving to local law enforcement about if you come across people who are violating the executive orders, mass gatherings, thing with restaurants now, fines, warnings? What's your guidance on that?
We are expecting people to abide by the law. We know that this order is new and that all of this process is new. We're hoping that we can pull together and hope that our local law enforcement and state law enforcement will work with businesses and organizations and people to make this work. But I'll be glad to let Secretary Hooks comment on that.
Sure, thank you for the question. We are not providing specific legal guidance to them. We are sharing the information from the order and to our partners in law enforcement. There are always practical concerns that they may take up. They should get their guidance from their local district attorneys and their local legal counsel about enforcement actions, but we are well partnered with all 100 sheriffs and the multiple hundred police chiefs around the state, and we work in tandem. And again, as the governor said, we are seeking voluntary compliance, and we're asking all of North Carolina to pull together because it's not only a public health matter, it's a public safety matter, and they go hand in hand.
Thank you. I had a quick question for Dr. Cohen, if she could. With so many cases, positive cases here in the Triangle, particularly Wake County, have any Triangle doctors tested positive or presumed positive yet?
So I don't know the answer to that question. So our epidemiology team has been doing the evaluation, and Wake County, I don't believe that they're sharing those kinds of details, mostly because we want to be sure we're protecting folks' privacy as we move through this, but we can see what information has been released from Wake County. Thank you.
So this will be for Dr. Cohen. So reiterating on testing, the criteria are still fever,
Cough.
negative flu, lower respiratory. And we have heard from some readers, we heard from one fella out in Cumberland County who tested positive, and he did not have fever, so he was delayed in testing. I mean, are we going to see more of that kind of thing happen?
So what I would say with the clinical criteria, and we said this in our message to all doctors that we sent last night, I need doctors to use their clinical judgment, as I would when seeing a patient, to make these decisions. The criteria are guidelines to help us make sure that we are getting those that are at most likely to test positive for COVID-19. Again, making sure we're keeping our worried well away. I understand there's a lot of worry out there, but we want folks who are more likely to have this to be the ones being seen by our medical professionals, getting the sample collected. And again, we want to also make sure, as we were talking earlier about the isolation is real, and they must stay in isolation. And so stepping up to a test is a major commitment for someone. So we want to make sure that we have criteria by which we're using so that we understand who is going to stay in isolation and who isn't. And again, things will evolve, and someone's illness may evolve. They have fever one day, they don't. They have fever in the morning, not in the afternoon. So always I implore our clinicians to use their best clinical judgment going forward. We're trying to ramp up testing, sample collection spaces so that folks have the ability, if they can't do it in their office, to refer a patient to somewhere where they can get the test.
So then when you have positives, it's local health departments who are doing contact tracing still?
That's correct. That's correct.
And then looking forward, do we know what kind of capacity we have for ICU beds in the state?
It's a great question, and that is the work that is underway to understand our capacity. We are basically in daily phone calls with all of our hospital partners and all of our medical partners to understand what our capacity. We do have those numbers, and to understand them. We also have the ability to surge capacity in our beds. We just allowed for some increased flexibility for all of our hospitals, and there will be opportunities to flip certain spaces into ICU. So again, those numbers can change, but we're trying to get a handle. What do we have now? What capacity do we need? And how can we make sure that we're not just thinking in individual hospitals, but across a region? How do we make sure we have the right resources for our folks going forward?
And this is the last, I promise. So you've got, there were strategic stockpiles of ventilators, and then, if I'm not mistaken, it's all moving so fast, it's hard to remember when, but I think it was yesterday the president said that governors should look for ventilators on their own. So what's the status of, getting extra ventilators so that we can have some surge capacity?
So North Carolina is in a situation where we do have ventilators at the state that we can deploy as we see necessary. That is the kind of collective action that we want to be understanding right now so that we can deploy those resources appropriately across our state. Thank you.
Explain why we have $3.8 billion in unemployment benefits in our reserves, and how that will be used with what you've laid out today.
Yeah, right now we do have $3.8 billion in our unemployment trust fund, and part of that will be used for this crisis and this order today. We're also analyzing the cost of this and believe that this is a reasonable step, and we'll look to potentially do more for people. But that money is there for that purpose. And I also wanted to say, in response to the other question, that our emergency management is working hard to acquire equipment, and that we are set up to respond to our local partners much like we have been in hurricane disaster situations, except now we're talking about more health equipment, and we're going to continue to work with our local partners to be sure that they have what they need. Thank you all very much.